Coming up on Just Us Gals, don't sleep on strict bedtimes and Fibre. I'm talking for you, not the kids. What every parent should know about the dangers of YouTube. Simple steps for us busy moms to optimize our health, and what's stress really doing to our bodies.
I'm Heather.
I'm Jess, and this is
Just Us Gals.
Welcome back to another episode of Just Us Gals, and we have such a good one for you today. We have Dr. Stephanie Liu, or you might know her better as Dr. Mom, on the show. Stephanie, welcome to Just Us Gals. How are you doing today?
I'm doing good. I'm excited to chat with you guys. I like talking, so this is fun.
Amazing.
And we love listening.
Yes.
If anybody doesn't know, your Instagram page is just a wealth of information and information about so many different genres. So it's so interesting to learn from you and follow along. So if you aren't already, please follow along. What is it? Life of Dr. Mom? Is that your handle?
Yeah, that's it. At Life of, and then DR Mom.
Okay, perfect.
And you talk a lot about that science-based, like kids and health and mom stuff, right? Is that kind of how you describe it?
That's pretty much it. Like I share my experiences as a mom and a physician, and then I like sharing evidence-based tips, so science-backed tips.
Very cool. So as you know, we like to start every episode off with a mom win or a loss. So Stephanie, what do you have for us this week?
This, what I would say was, I thought my biggest loss was when the biggest mom fail, or how you call it, was when I had my daughter Maddie. One of the things I was looking forward to most was breastfeeding. I said, oh, I'm so jacked. The bonding, all of the nutrients from breast milk, I just couldn't wait to do it. And then when I tried breastfeeding for my daughter for the first time, it really hurt, and I wasn't able to get her to latch. And it was one of the strangest feelings, because I remember just feeling like a failure, and I was like, freaking sucks. I was feeling really not good. And then I thought about it, and now over the years, I'm like, man, it's really interesting. That's kind of one of the reasons I started the blog, was sometimes we think things are failures as parents, but it's totally not the case. I don't think that, when I was looking there back then, when I struggled with breastfeeding, I said, okay, it's like, I'm not a good mom. I'm not supporting Maddie the way I need to. But then looking back, I said, it's not a predictor of love or how mine and Maddie's relationship is going to be later on in life.
It's true. Very true.
What I thought was a fail actually wasn't a fail. And so that's why that was actually one of the inspirations for why I wanted to start a blog, was to not just share the science stuff, but also I think sometimes we get these emotions as moms, and we get this guilt that we might feel, and we actually probably shouldn't be.
Oh, I completely agree. I had that experience with my second as well. I just couldn't figure out. But I actually remember that you had a post many years ago that was just like, formula feeding is okay. It's just reiterating that over and over again, and it is so important to remember that, because you do feel like a failure, because you just think you're supposed to be able to do this. This is supposed to be easy, but it is not. It's so
But that's
far
the thing.
from easy.
Nobody warns you that it's difficult, and I feel like 9 out of 10 moms I talk to struggled with nursing. They that baby just does not go on the boob easily the first time, and they make it seem like they should, right?
Yeah, they do.
And I'll
you
say,
both have to
back,
learn.
When I was before I had kids, I was kind of an asshole. I'd say I'd be all preachy. Breastfeeding is the best form of nutrition, which is true. We know that the many benefits of breast milk, and I'd say, yep, you gotta be breastfeeding. That's optimal. I said the nutritional benefits are better than infant formula. And I think that that's something that sometimes physicians propagate. At least I know I did that. And instead of looking at the whole picture, right? Looking at how the mom is doing from a mental health perspective because she can't breastfeed. Looking at, the child too. We know now that infant formula is a safe complete form of nutrition too. And so I think that actually changed my practice too, because I thought about how I felt, and I said, I felt like such an asshole, because I said, oh my gosh, I made some of my patients probably feel really shitty too.
Yeah,
I love that 360 you did. That's awesome, and I love that as a physician, that you can recognize that, oh, maybe I was wrong on this one, but you learn and you grow, right? You're human.
Totally. So now when I approach it, I still like giving the evidence and say, if you are able to breastfeed, that is the optimal situation. But if you can't, that's okay too. There's other safe, healthy options.
That's really cool. I love that. Heather, are you winning or losing this week?
I'd say the biggest thing that I'm struggling with at the moment is, so I'm going with a loss, is I have a 2.5-year-old and she still naps. And sometimes, and so this actually happens in the morning too. If I have to wake her up, she is like possessed by something. She's so angry and I don't know how to deal with it. I just have to like let her have a tantrum for a little while and just be completely angry. I don't know what to do. I'm completely at a loss. I've never seen someone so angry. Like my oldest, she's always like, I'd wake her up and she'd just look at me and then just smile and be so happy. And it was just the sweetest thing. And then I go wake up Chloe and she's just like, I wanted to sleep. And I'm like, oh my God. I'm like, I just leave. I don't know
and
what
now
else
do you
do.
have to wake her up now because Penny has to go off to school? Like summer's
So
over,
this morning,
time to get up?
This morning, yes. And then from naps, because she'll just keep napping. Like she was on a 4-hour nap
Girl
this
loves
past
her
week.
sleep. That'll be nice when she's older though. Mark my words.
Hopefully. Exactly. But I was just like, okay, if you nap for 4 hours, you're never going to go to bed. So I was like, I have to wake you up. And that's when she screamed at me saying, I want my sleep. Like, never seen that before. I was like, whoa, is this? I'm like, and then I'm like, is she even awake? This doesn't even seem like Chloe. But I just left. I didn't know what to do. So anyways, I'm struggling with how the heck to wake up my demon child.
That is a tough one. That's a really tough one.
Yeah,
do you ever deal with infant, or I guess she's not an infant, but toddler sleep, Stephanie, when in your practice?
My kids get grumpy. My husband gets grumpy when I wake him up too, and I know
fair.
I sometimes get grumpy. And it's interesting. Like I found from my son how he likes to be woken up is really, really softly. So what I'll do is I'll give him a little kiss on the head, and then he'll kind of stir, and then I'll give him another kiss on his head and a little one on his hand. And then he's still a little bit grumpy, but it seems to be a little bit better. Versus before I say, hey guys, get up. And they'd be like, Mom.
Right.
I'm annoyed with me.
Yeah. Maybe you need to approach it differently, Heather. Try a few different things and report back. Yeah.
Well, okay.
No.
That'll do. Because I do the gentle approach because that's how my oldest likes to be woken up. But maybe Chloe is more of a, get up, tell him wake up, and then just like, get dressed. And
ring the cowbell.
Yeah. That's how I woke her up from her nap actually the other day because I was too afraid to go in to wake her up. So I just started clapping outside of her room really loud to convince her she woke up on her own. And it worked. She's like, oh, I'm awake. I'm like, oh, great. Oh. So I guess I just got to stomp around and bang pots and pans outside of her
Let
door.
her like naturally wake up from the...
Thinking it's herself, not me. So.
Totally. Interesting. Okay. Well, I'm going to be a bit of a vibe kill here. I'm going to talk about that I was let go of my job yesterday. Right. That I've been there for 9 years. However, it's given me some clarity and an opportunity to recalibrate and spend more time with my kids. And
so a win for your kids.
So a win. I'm turning this loss into a win. So it's... Oh, my dog's barking. Yeah, so anyways, I think I have a loss and a win this week because I get to spend time with Parker, my 3-year-old, who I never got to spend the same amount of time with her as a second child that you do your first, right? Especially during the first, there was a pandemic as well. And, oh my gosh, can you hear him?
Yeah.
He always interjects himself into this podcast one way or another. He loves it. There we go. Good boy. So anyways, with the second, you don't always get to spend, right? Because you're busy with the first and the second's just along for the ride, and subsequent children, I can imagine. We all stopped at 2 here. But so every Tuesday, Thursdays, because she goes to her pre-K program Monday, Wednesday, Fridays, I'll get her, and we get to spend the whole day together Tuesdays and Thursdays because my oldest just started grade 1. So I'm actually really excited about it.
She's going to love that.
Play cafes and the library, and she's a bit delayed where her older sister was on learning her letters and her sounds. So we're going to work on that. We're going to do mommy preschool over here. It's going to be great.
Perfect. Yeah.
Yeah.
So that's nice.
Amazing. You had a tough. This was like, I'm just thrilled that you came on, like, because I'm like, that's a huge thing that happened, and you were like, I don't know. I just think your perspective is awesome, and I'll say like sometimes I think when things don't go exactly as they're expected, I think that also leads to a lot of really good opportunities too.
You're kind of forced in a different direction, right?
Yeah. So I saw a thing on Instagram or maybe it was TikTok, and this is totally about relationships, but I think this works here. It's like to think of rejection as redirection. And I was like, ooh, I like that. It's a positive spin on it.
You know what? So I was
redirected elsewhere.
Totally. And I was talking to my girlfriend, Joelle Tomlinson in Calgary. If you don't follow her, you should. She was let go from her news job a couple years ago when they made a bunch of cuts. And she was devastated. And she does a lot of public speaking now. She does a lot of emceeing and hosting gigs. But one of her jobs was, hey, can you talk to these kids about how to bounce back? And she said, bouncing back, and this can be applied to like maternal health as well, postpartum, bouncing back it doesn't resonate with me, is what she said. Because I don't think after something like that happens, you can't bounce back to where you were before, because now you're not the same person, but you can bounce forward, right? And you're
I like
right,
that.
because you've changed who you are as a person, your mentality has changed, and now you need to move forward. So I kind of liked that, similar to what you said, Heather. You can't bounce back, you have to redirect or bounce forward. So that is what I'm trying to do. And that, like I said, can be applied to postpartum as well. You can't bounce back after you have a baby. You need to accept your new form and move forward, right? And do what you can to help things along if you so choose.
You know what, Heather, I'm going to tell you guys something that I actually don't like telling people because I'm kind of embarrassed about it. So all I wanted to be, my parents told me when I was little, was to be a doctor. They're like, you got to get to med school, go. And when I applied the first time, I didn't get in. And it seems like such a minor thing when you're little. I felt like devastated.
I bet.
The world.
I didn't get in because I had really bad social skills at that time. So part of it
No
was
way.
I was academically dominating, like really. I was the grades academically, and but the interview, because you have to go, it's almost like speed dating. You go through and you do all these interviews with people. I just came across bad because I didn't have life experience. I was a weak communicator, and those are things that you should have when you're going into medicine. And I got absolutely rejected from all of the interviews I had, and I was feeling really down on myself. And so I knew I had a year and a bit before I could apply again. And so what that led me to do, which now I'm very fortunate, was because remember I said I was good at school, so I had these really good grades, and I was pretty good at taking these exams. So I took an exam to do a master's instead, and I ended up doing a master's in nutrition at Columbia in New York City, and that was probably one of the best experiences of my life. One, for the nutrition background, they don't teach enough nutrition in med school, I don't think. So that's really helped me in my career, and even as a human being, having a strong nutritional background is a really good thing. And it gave me those life experiences too. I got to live in a different country. I got to learn how to make new friends. I had to learn how to socialize and how to present myself, and how to be, I think, someone that was more well-rounded, because I went in there with just die hard, get into med school, but with none of the other skills that needed to be there to become a well-rounded physician.
Sometimes life's flops are actually life's gains.
Yes.
For sure. Yeah.
Totally.
Yeah.
That's really cool. Thanks for sharing
It is.
that.
I like that
I
story.
don't like spreading that around, but I guess it's kind of what these because I was because I'm so goal oriented, and when you get smoked and you get rejected, and it's almost more embarrassing because they're like, oh, academically you're okay, but as a communicator and an interacting person,
Totally.
Yeah. You're so I'm smart enough to be here.
On the interview, it's oh, it's just my communication they don't like.
I'm the opposite of you, Stephanie. I would absolutely nail that interview. They look at my report card and be like, ooh, I don't think so.
Oh, no,
Go back
it
to
was
school.
Yeah, I don't think so. So one thing you recently posted, and I kind of want you to elaborate a little bit more on this, is 7 things you would never do as a physician. And one of them was get less than 7 hours of sleep. As a busy mom and a doctor, how is that possible that you can get so much sleep? And can you talk about the importance of getting at least 7 hours?
Yes. So sometimes I don't like posting that because I'm as a new mom, I definitely didn't get it. When you have a newborn that's waking up every 2-3 hours, it's impossible. And I'd even say when my kids were toddlers, it was hard because they would still intermittently wake up at night too. So that's one thing. So there's just going to be periods of our, and during residency, I'd be on call. And when I was a new staff, I was on call. So there's going to be periods in our life where we're just not able to get that just because of like specific work circumstances or your kids, right? It's unpredictable. But once my kids started sleeping through the night, and I started reading more on the data of the importance of sleep, I make a commitment to it. And so for myself, what I do is I set the same bedtime. So my goal is to be in bed by 10 o'clock.
Okay.
And I do a routine before that's like calming. I don't look at my phone for leading up to it for at least half an hour.
Okay, half an hour. Okay.
At least half an hour. And then I try to like initiate bedtime. I don't fall asleep right away. Sometimes it takes me about 30 minutes or so, but I listen to a meditation app and I go to sleep. The reason I set the firm bedtime is you guys probably all feel this way. There is endless amounts of work to do.
Yes.
Literally endless. Like we could work every single day for the next 2 weeks and we still wouldn't get that. We could full 24 hours, we wouldn't get it. But I said for me to be able to function better the way I want and for me to be happier, I need to sleep at least 7 hours. The importance of sleep. So there's data that shows that if you're getting consistently less than 7 hours, you're at a higher risk of getting colds. Your immune system goes down. You're at a higher risk for heart disease. You're at a higher risk for metabolic issues. So that means like at an increased risk for diabetes. Your mood will be affected. It can affect your emotional regulation too. You're at increased risk of anxiety issues and having a low mood.
Emotional regulation, that I can attest to. When I'm well rested, I am a better mom.
Patient, I find.
Yes.
Yeah, like for my kids, I can sometimes hold it together, but even my clinic staff, like sometimes when they know I have like a bad night's sleep, like if I have to have an early TV segment in Toronto, I go to work and I'm a rage monkey. Like little things that wouldn't set me off, and I'm like a rager.
Irritable.
Yeah. So the mood stuff too, and also productivity. When you're sleeping better, your brain is processing things better.
Okay, yeah, I've heard that like you can like your brain takes the time to like digest everything you learn throughout the day and everything too. So like you actually like I was listening to a podcast, I was saying like for kids it's good to a good way to study and to learn is to like not like cram everything in all at once, is to do just little bits kind of each day and then sleep so you can like internalize it or remember it and then just keep repeating that process and doing that and things will stay better that way instead of like 3 hours of nonstop cramming, which I mean I definitely remember doing that.
Yeah, I did that too. But yeah, sleep is so important. Like if there's even studies like specifically on teenagers that say that if teenagers are getting an extra 15 minutes of sleep that they need, they're going to be better at reading, they're going to be better at problem solving and at focusing.
Teenagers specifically.
This was just a study I read recently about teenagers, but I think it falls across many age categories.
So what?
Well, I used to sleep till noon, so I must be brilliant.
You're brilliant. Heather.
Just brilliant over here.
So for our kids, you have how old is Maddie? Grade 4?
She's going into grade 4.
Okay, yeah. So you have grade 4 and we all have a kid in grade 1. So how much sleep do you strive to give your kids so you feel like they're ready for the day?
I want them to my goal is at least 10 hours for both.
10. Okay, same with mine. I'm glad that tracks.
But you know what was interesting? We were kind of chatting about this before I went on, but I was saying the back to school time was such an interesting time. Like, and I really see like how even though kids can have similar genetics, how different they are. My son was like jacked, ready to go to school. Like he even says like Mr. Popularity in kindergarten. He was just excited to go back. But my daughter is very reflective. And she was saying to me, she's like, Mom, I'm just growing up way too fast. She was like,
so adorable.
Soon I'm gonna be in grade 5 and then grade 6, and then she's like, and then I'm gonna have to go to university and all of this stuff. And I was like, it was just so interesting, like how she was, because I obviously feel like she's growing up too fast.
I was gonna say, like, welcome to my head, kid. Like,
I know. That's what I'm thinking.
Yes.
So when I dropped Penny off, I said to her, I was like, Penny, look around you. These are the kids you're gonna grow up with. And then I was like, then that hit me, and I just started sobbing. I was like, thank God I have sunglasses on. I was like, oh my God, she's going to grow up with these kids. I'm going to, looking back on this day. And I was like, no, pull it together, Heather.
And you're
pull it
starting
together.
again now, Heather.
Yeah, I am. Because I think about it, it makes me sad.
The first day of school, the bell rang and they went in and I started crying, but I forgot my sunglasses. So now all the moms were like, Jess! And one's like, I can't look at you or else I'm going to start.
Yeah.
It's just like,
I
oh my
can't help
God.
it. Mm-hmm.
Okay, I really want to talk about kids and YouTube because YouTube is something that I don't let them watch in my house, but why are they so obsessed with it?
I know.
It's so, I did tell Emmy, my 6-year-old, that, okay, you can watch YouTube if I approve what you're watching and I'm there to watch it with you. And like, if they don't have tablets or anything, so everything's always on our big TV. But even at that, like, you completely banned it. Is that correct?
So, you know what, with you watching it with her, and like, it sounds like you're looking at more like the long form content and you're controlling it. I think that's a lot safer. Like, for us, we just got rid of it because my kids do have tablets where we take it on vacation, but we prefer to download movies for flights. The reason YouTube is so addictive is there's a lot of like that short form content. And so for my kids, I would watch them and they just kept changing the channel. And that fast-paced stuff that's on YouTube where, you know, when it says, oh, watch the next show and you're clicking, though every time they're clicking and seeing new, fast, like exciting content, they're getting hits of dopamine. And dopamine's that pleasure thing that's released in our brain. And that's how we can develop kind of addictive tendencies too. And there's been times, even as me as an adult, I am pretty strict with my screen time for like social media. Is I can catch myself scrolling on those reels, going to the next one. Okay, want to watch the next one.
They're addicting.
Oh,
Very
I'm
addicting, right?
guilty with TikTok for sure.
Yeah, and that short form, like kind of quick stuff, it's engaging and it makes you want to watch. And anytime you're seeing something new and exciting, we're getting those hits of dopamine, which also drives that addictive behavior too.
And are they okay with you cutting them off like that? Like, what? How do you deal with the pushback?
Yeah, so I'll say no. They were like, you're the worst. Like, I don't want you to get rid of it. But I would just say, I said, Maddie, Georgie, I said, I love your brains. I said, you've got really, really good brains. And I said, we can watch TV. We can watch movies. I said, it's not end of TV movies. I said, but I don't like it when you guys just keep switching from channel to channel because it's not the best thing for your brain. And over long term, it's going to mess up your brain.
Yeah.
And so when I explained like that, I was like, you only have one brain. Don't you want your brain to be good? And they're like,
love
okay,
that.
yeah, sure.
Do you think the same could be said? I've heard that about shows like Cocomelon, where they're just all very like flashy and colors, and it's constantly changing what you're seeing compared to like Miss Rachel, where she's kind of on screen longer. I don't know how much truth there is behind that, but that's just one thing I have read is that Cocomelon is so addictive to kids because it changes so quickly.
Yeah,
and it's flashy.
I think the flashy, constantly changing, that's like, it kind of draws you in, right? Even when we're watching social media, like I kind of like the flashy little bit movie things, right?
Totally.
Where it's popping up because it's more engaging, right? I'm going to actually check out Miss Rachel because I've not seen this before. I'm going to show it to my kids. It's called Miss Rachel.
Yeah, how old is Georgie?
He's 5.
He might even be a little too old.
You know what though,
now.
Heather? They have
She
like a
does have-
reading one.
Oh,
And-
that's right. She does have older stuff now.
On YouTube, they have a reading one, and I put it on for Emmy, and she just like felt like she was on cloud 9 because it gave her so much confidence because they were talking about letters and this and that, and she was getting the stuff right, and then so she wanted
cute.
more because she felt smart, right? So
That's great. Yeah. I'm a big Miss Rachel fan in our household.
oh yeah,
I feel- Chloe's learned a lot from Miss Rachel. I won't lie, but I'm not complaining. I like what Miss Rachel teaches her, so
Yeah.
I'm on board for it. But she
Yeah.
loves Miss Rachel, and it's helped the sounds because Penny has the speech
Oh,
issues,
okay.
and Miss Rachel teaches how to say different sounds with your mouth, and
Yeah.
that's what Penny struggled with and is still struggling with. So I'm hoping that I put that one on a lot because I don't want to have to go through that with Chloe as well.
Yeah.
So yeah, I like
That's fair.
Miss Rachel household here.
Stephanie, I would love for you to actually maybe watch it and review it. I don't know if you'd want to do a post on that, but for like Miss Rachel lovers like us,
I'm going to check it out. I'm
Yeah,
I'm
check it
gonna
out.
wrote down Miss Rachel.
Perfect. And then, because I know that, like, you see all these posts and it's like, oh, show them shows from the 90s. Franklin, Arthur, like Little Bear, Bananas in Pajamas. I've tried. My kids want nothing to do with those shows.
Because I think it's boring.
Yeah.
Yeah, I've tried Arthur, and that one seemed to be okay. But that's because I sat down on
I
it and was
love
like,
Arthur.
Kind of a game changer for what we started doing because we're really trying to reduce the screen time, especially like during the week, even for all of us. Because I sometimes like vegging in front of the TV too.
Yeah.
It's audiobooks.
oh, yes, I love that.
Love
On your TV?
audiobooks. Well, you could put it on your TV, or you could just put it on like your phone and make it loud. Like
Heather's
one
kids
of
love
the-
their Yodo.
Yeah, Penny has a Yoto player, and it reads out
a
stories.
Yoto. I
She's
should
obsessed.
get a Yoto too because my daughter loves like Matilda Roald Dahl books.
Yes.
And those are good. Like even as I listen as an adult, I'm like, whoa, it's really good.
Oh, I love that. I think that's smart. That's good. I like because right now they're more short form stories Penny likes, but I'm like this could evolve and because they do have like the Harry Potter books, but I will be reading Harry Potter to Penny because I want to reread them as well. But they do have like the longer ones as well for the Yoto player, and she listens to it because I still do a quiet time if she's at home because I need a break. So she goes to her room and she listens to her Yoto player for an hour. So I'm a big advocate of those audio.
Yeah, because they're using their imagination too.
Not just sitting like
they're
a zombie.
so good. I was just gonna ask you because you briefly touched on it, and you were talking about sleep, and I was just curious about, you know, as moms we're always so stressed out, and whether that be because you're working a full-time job and a mom, or you're a stay-at-home mom, or everything, trying to just balance every single thing. What kind of role does sleep play with stress, and how does stress affect us, even as because I even think as we're getting older too, like how is stress affecting my aging?
You know, I've been reflecting on it a lot because I would say like everyone is going to have like stress in their lives, right? And I would say sometimes I don't like it because sometimes when I come home from work, I feel a little more amped up than I'd like. Like I just feel like just kind of exhausted from the day, and I'm kind of ruminating about some of the interactions, about you know, the company, is it growing in the right direction, all that stuff. And so I've been trying really hard to reduce stress because, you know, Heather, you touched on it. There's actually really good data that prolonged intense stress can actually weaken our heart. It's bad for our immune system, and a lot of stress can actually make it really hard for us to sleep too.
Oh, wow.
So the few things that I've done that I think have helped me a lot is at 4:30 at least 3 times a week I will go do a workout. It might be a workout class, or might just be a little bit of a treadmill and I'm watching a show. I just need to get movement in my life. The other thing is when I first wake up in the morning, I'm trying my best to not let myself get amped up. So what I do is I try to avoid things that could get me really aggro within the first 15 minutes. So I'll wake up, I'll go do a face cold plunge, like somewhere directly. It just sets my mind in the right frame of mind. It relaxes me. It feels kind of crappy like right away, but it relaxes me. And then I'll go make a cup of coffee and stand by the window and have my first few sips. And then I'm like, okay, now I'm ready to go through the day. So, you know, I try to start my morning right. I try to make sure I get movement in my life because that helps reduce stress. And then I make sure that I get sleep because when I sleep better, I'm able to handle stress better. And I want to show you guys something because you guys are probably like, how are you getting? I'm going to pull it up. Now I want to check myself too. I track all of my. So for the week, 7 hours and 56.
Oh, nice.
Wow.
That's amazing. And look at the consistent bedtime.
Yeah.
Looking good.
Yeah.
Thank you guys.
Looks like my kid's Huckleberry app back in the day.
Oh, yeah. Except for it was a lot more choppy. Awake, asleep.
Yeah, it's true. That is, so that's your Apple Watch you wear to bed?
I do. And like, because that's the thing, like I don't want to, like I'm giving all these health tips and I would feel like an asshole if I'm saying you need to sleep 7 to 9 hours, but I'm sleeping like 4 hours, right? Because then I'm not practicing what I preach, right?
Yeah. And I like that, holds you accountable when you actually have an app that tracks it too.
Totally. However, what are your thoughts on, I actually just started wearing mine again to track my steps, and I used to wear it to sleep, but what are your thoughts on like Wi-Fi and Bluetooth and like permeating the brain-blood barrier and all that stuff that's kind of trendy on social media right now?
I've heard about this. Like I did a quick search online. I wasn't able to find the harms, but I'm not an expert in that area. I'll say personally, I like tracking my data because it holds me accountable. And I think that for me, the benefits of me knowing that I'm getting like a certain amount of sleep and a certain amount of steps outweigh the risk to me. But I haven't had all of that data yet.
Yeah. So overall, when we look at women's health and just overall wellness, what do you think are the markers of good health in terms of, I know we touched on sleep and stress reduction, but for you, what does the bigger picture look like?
Yeah, I think nutrition plays a huge role too. And for me, one of the things I've been trying to do is not just protein, but making sure I get a lot of fiber. We don't get enough fiber in our diet. And so I even take a fiber supplement every morning, and I love it. It's called Barely Craving. It's actually an Alberta-made fiber.
I bought that.
You bought it?
Tell me how you use it, like where you put it in. I bought it. I haven't used it yet.
Oh my gosh, I cannot wait for you to try it.
Really? Okay.
I'm intrigued because you said where you put it in.
It's like a powder, so like you can add it to your food or drink.
What you put it in. Okay.
I am obsessed with this fiber. I'm obsessed with it so much that I'm actually going to probably get involved with the company because I take it and it's been a game changer for my own health.
Oh, I thought you were involved with the company because I saw it through you, but you're not.
Yeah.
Okay.
Well, I am going to be.
Okay.
So full disclosure there. So what it is it's a pure soluble fiber that's extracted from barley. Okay. And there's clinical studies that show that this fiber is the specific fiber is a prebiotic. So that's the healthy, that's what the healthy bacteria, the probiotics need to eat to thrive. So it's good for our gut microbiome. But the other reason I like it is because it helps keep me full in the mornings. And I like it because my days are so busy. So there's actually studies that show that if you take a certain amount of it, it helps keep you full throughout the day.
Okay. And so
that also helps regulate your blood sugars.
Okay.
Because I know I feel shitty when I'm getting like low blood sugars or if I get a spike and a crash. So I love it because one, it helps regulate my blood sugars. It keeps me full and it helps with my digestion. Yeah. And the reason I also got involved was, at least for me, like I think I'm entering like this perimenopause stage of life soon, right? And I've noticed that my metabolism's kind of slowed down over the years too. And fiber is one thing that's really good for us, like to help kind of battle that. And two is I don't have that much time to eat in the morning, and I'd rather have like a good fiber that's keeping me full throughout the morning instead of like grabbing things that I wouldn't want to eat anyways.
So that is everything you touched on. Is that what the importance of fiber is in our diet, helping to like with our gut microbiome regulate those spikes and crashes? And is that okay? Yeah, I was always, I've heard that a lot, like we need more fiber, but I wasn't sure what the importance of it was.
And for our digestion too, it helps keep you regular too.
And that's key.
Yeah. It helps.
I know we all struggle.
For sure. And the one thing that I'll say though with specifically with a Barely Craving, it took me a while to find like the optimal dose too for myself.
Okay.
So I would start low and then slowly increase it.
Okay. So protein, fiber, what else do you see part of that big picture for our health?
Yeah, I think this is going to sound crazy, but I think meaningful social interactions.
Oh,
I think
I agree
that's a good
with that.
point. Yeah.
So I'll tell you, like, there's actually data that shows, they've done studies where they say that people that, like older people that have consistent, at least 10, 15 minutes of meaningful social interactions, they live longer. For me, it makes sense because, after I have like a really positive interaction with a friend, family member, even with a patient, like I feel happier. Even my outlook towards life is a lot better. So every day I'm trying to find these interactions that make me feel good. So positivity, social interactions are really important. And I think another thing is, have you guys heard of the blue zones?
Yes, I watched that documentary.
Yeah, so these are areas in the world where people live longer and happier lives. So one of the other things is they talk about downshifting. And so what that means is everyone's going to have stress in their lives, but finding ways to cope with it in a healthy way. So for me, that's the physical activity. And so I always try to incorporate movement into my daily life. And another thing that I started too is incorporating weight training too.
Yeah, I've heard.
I hear that's
about
so
that.
important, especially for aging women.
Because isn't it
muscle.
once you hit menopause, it's really hard to build more muscle is kind of what I've heard. And so as much as you can go into it with, as much muscle as you can have, the better. And then of course, the fact that is that one of the like leading cause of like, not death, but like a decline in good quality life is as you get older and people fall. And then you break something and that's that. Your hip is gone.
Like so on. Yeah, so like muscle health, like
Nailing it.
training.
Nailed it.
So the strength training is also really good for our bones, right? But you don't want frail bones. So like vitamin D, having calcium is important for our bones. Weight training is good for our bones. But the other part of it is balance. If you're able to have good balance as you age, your risk of falls go down, and you also are just like you don't look as frail. You're moving better. And so, I'm a big dork. I like quoting studies so that people know I'm not talking out of my bum, right? So there's studies that show that if you can balance on one leg for I think more than 15 seconds and you're over the age of 50 or 60, your mortality goes way down.
Amazing. That's really
Wow.
cool.
That's
Okay,
really
so
neat.
on this kind of topic then, and maybe you said it and we'll just like reiterate it, but what is like one small thing or change that we as women can do today that will really be beneficial for our future selves?
Fiber and sleep.
Okay.
Wow. Okay, I really need to crack into this barely.
I know the fiber one. I
craving.
really
I
need
am
to.
like obsessed with fiber because for so many years I love I love eating fruits and vegetables. Like I just love it. But like fiber is so important for our gut microbiome.
I did not know
So
that.
important. And the one area of interest for me is the gut microbiome. And when you're getting fiber in your diet, whether it be from food or additional fiber supplements, you're feeding the good, healthy bacteria.
And okay, so fiber does that.
Yeah.
That's super
Certain
interesting.
types of fiber. Like I just,
Yeah.
Can I give this to my
That's fiber.
kids?
Yes, you can.
My daughter was just on antibiotics for a abscessed tooth. Last episode we talked about that. Anyways, update, she had her dental surgery. Everything went perfect. Anyways, after antibiotics, should I be giving her a lot of fiber?
So I think yes, right? And like obviously checking the back of what the packaging says. But I know for the barely craving, that's a pure soluble fiber, and that's fine to give your child. So I think fiber is good for all ages.
Okay,
That's good to know.
That's really good to know. Stephanie, tell us, we'll let you go here, but tell us about Dr. Mom and some of the products you have and maybe what's next.
Yeah. So I would say a lot of why Dr. Mom was created was because, I wanted to build that mom community, but I also saw a need because I practice as a family doctor and my patients are actually my inspiration. So I started Dr. Mom Skincare because a lot in Alberta, a lot of you guys might notice you get dry, itchy, irritated eczema skin. And anytime when skin gets really irritated, I'd often prescribe a topical steroid. And my patients would be like, Dr. Lee, we really don't, like, we're kind of scared to use the topical steroid because, like, it can thin the skin. And with too long use, like, our skin can become addicted. And they're actually they're right? We know with prolonged topical steroid use, there's risks. So they asked me for natural alternatives. And I went online, I looked, and I said, there's actually really limited stuff out there. So I kind of went more searching. And one of the things that kind of fell into my lap is I'm a professor at the University of Alberta, and I get new and upcoming research. And so at that time, something called beta-glucan, it's a fiber found in oats and barley. They were saying that they were developing a new extraction technique for it. And I said, how have I heard about beta-glucan before? So I realized where I heard about it was from Korean skincare. So I'm a big fan of
I love Korean skincare.
And in Asia, people have been using beta-glucan for years for ways to hydrate, heal, anti-age. And so what I did was I reached out to the team at the U of A and I said, hey guys, I want to partner with you guys to use that technology that you have to make a natural skincare line. And so
I love it.
So I got allergists on my team, family physicians, researchers, pharmacists, and we created a whole new skincare line using beta-glucan. So clinical studies show that beta-glucan helps heal and hydrate the skin, which is critical for conditions like eczema, dry skin, skin irritation. And we started it with just the soothing bath. So people put this into their bath.
I have that, and I also have your cream, and I also have your apple juice.
Oh my gosh, you're amazing. So that was it. We started that, and it did really well. And one of the most exciting things is, I want to keep this local. Like, we started in Edmonton, we're expanding outside of Alberta, but we just hit our 600th retailer in Western Canada.
Oh, wow.
Congratulations.
We're at London Drugs, Federated Co-op, West Coast Kids, TNT Supermarket.
Amazing.
And our goal for this year is we're going to continue to expand out east too. Wow. So creating something that can reach families, like that fires me up.
That's huge.
Yeah.
Congratulations.
Oh, thank you.
Wow.
But it's because of the community. Like, I don't think people realize sometimes, like, when you're starting a company, like, the first goal should be like, do good, create something that people need and there's a problem to solve. But the second is if you have a community of people and that trust you and you want to work together and grow together, then it happens. Like, it just makes things so much easier and also more exciting too.
Hey, selfishly, I have chronically dry elbows. Will that help me?
Yes, it will.
Okay, good, because I'm sick of my husband and my daughters making fun of me all the time. Like, Mom, what's wrong with your elbows? I'm like, I can't fix it. They're always dry.
No, I'll
Just
tell
need
you,
some Dr. Mom in your life.
I have really dry heels. And like my heels are like just like they were horrible. And I apply this and it helps me a lot. So
Okay.
I like it.
Perfect.
And isn't
That's all
that
I
what
need
the
to hear.
Barely Craving is as well? Beta-glucan?
Yeah.
So here we are again, full circle with the fiber.
Yeah.
Of a technology. And that's the thing. Like, I think when you love your community, you want to highlight the research and R&D.
Yes.
We have world-renowned researchers at the University of Alberta. And like, I love being able to leverage those massive brains and working with them.
Wow.
That's awesome.
Incredible. Okay, well, Dr. Stephanie Liu, thank you so much for this. This has been like so eye-opening. I could pick your brain. Honest to God, we could be here all day. I just love listening to what you have to say.
Oh, you're making me feel so good. I love chatting with you guys. As you guys know, I like talking. I really like the talking.
Well, you've become very good at it.
You have become very good
I would put you in med school.
And on the first try.
On the first try.
Oh my gosh, you're making me feel good. Okay, can I quickly summarize? Because I felt like I was rambling.
Of course.
Things I would do for my health is make sure you're getting enough sleep. Make sure that you're having meaningful social interactions. Get enough fiber and protein. And move your body. And also have nice morning and bedtime routines.
Consistency, yeah.
Consistency.
That's nice.
Something I need
that.
in my life.
Yeah.
Maybe I'll get it now that I have
it'll be
nothing
easier
but
now.
time.
Yeah.
Yeah.
Take care of yourself.
Yeah, absolutely. Heather, why don't you take us out with where people can find us?
You got it. So you can find us on Instagram and TikTok at Just Us Gals Podcast. And we're also on Spotify, Apple, basically any platform you can listen to podcasts on. You can email us at chatwiththegals@gmail.com. And as always, please reach out to us. We love having conversations. And, some of our guests we had on the show are people who have messaged us or DM'd us and saying they have something interesting they would like to share. And that's what we want. That's what we love to do. So come on out, come join us, and also give us a review or rate us, whatever you want to
Please do. Yes.
Yeah.
Okay, well, Dr. Stephanie Liu, thank you so much, and we'll see you next time, guys.